Moving on for now, German Chancellor Angela Merkel on Wednesday said that the government will be extending its virus restrictions till the 10th of January in order to contain the virus spread. The virus curbs include keeping the restaurants and hotels shut and limiting private gatherings to 5 people. The measures were earlier scheduled to expire on the 20th of December. While the daily rise in infection numbers started to decline, Germany reported its highest single-day death toll on Wednesday. More than 17,000 new cases were reported overnight and 487 deaths. Germany's head of vaccines the vaccine panel said that it will take over a year to vaccinate all of Germany's population. Germany is currently preparing vaccination centers across the country so it can start offering the shots as soon as a vaccine is approved in Europe. This as Britain became the first country to approve the Pfizer candidate and is all set to vaccinate its people from next week. Merkel said the federal and state governments are preparing for the vaccination program and that the first vaccine approvals in the EU could happen towards the end of December. With applications by BioNTech, Pfizer, Moderna for the use of their COVID vaccines in Europe, Merkel said 70 million doses in total from both types of vaccines can be delivered in the first quarter of next year if they are given authorization. As the UK and Russia announced their vaccine rollout plans, let's give you a sense of what things are looking like in Germany, where the virus restrictions have been extended till the 10th of January in order to contain the spread of the virus. This includes keeping restaurants and hotels shut and limiting private gatherings to 5 people. And these measures were earlier scheduled to expire on the 20th of December, but they will now be extended till the 10th of January, given that more than 17,000 new cases were reported overnight and 487 fatalities. There has been a spike in the COVID-19 cases. We're now joined by the DW correspondent, Chelsea Dulani, live from Berlin. Chelsea, hi. The UK plans to start vaccinating people against COVID-19 as early as next week after becoming the first country to approve the vaccine. How far behind are the EU and Germany in particular when it comes to the vaccine race?
Well, the EU is sending a really clear message here. They're saying they want to move slower than the UK. We have seen this really boil over into a bit of a showdown between the UK and other countries that have yet to approve a virus vaccine. You mentioned it earlier, but we've seen a lot of comments from the EU, from the US, criticizing how fast UK regulators were in approving this. They had just 10 days after receiving the data to look it over. And the stakes are very high for regulators. They need to make sure they're not making mistakes, that they're not rushing the process, because there is still quite a lot of skepticism among the general population about the vaccine and how fast this process has moved. So the EU is saying they want to be extremely thorough in their process of looking over this data. They had planned to hold a meeting in mid-December to decide on the approval of the BioNTech Pfizer vaccine. They've actually pushed that back a couple weeks now, so they now plan to meet on December 29th to discuss the approval of the vaccine. This is because they say they need more time, that they're not ready to make a decision yet. But that likely means these hopes that we had that we could see a vaccine being rolled out in Europe and Germany before the end of the year, that likely won't happen now, because even if the EU Medicine Agency, the regulator, approves the vaccine on December 29th, individual EU countries will also have to make the decision to approve the vaccine as well. So we're looking more at early January for the rollout of this initial Pfizer-BioNTech vaccine, and then later in January for potential EU approval of further vaccines like the Moderna vaccine or AstraZeneca.
All right, Chelsea, we've heard public health officials repeatedly warn that the rollout vaccine will take time. Looking at the distribution plans the European governments have laid out, how far are we from that crucial point of herd immunity?
We're still quite a ways away. So even once the vaccine is approved in Europe, even once it starts to be rolled out, it will be a long process. Initially, most European countries plan to target this vaccine at the most vulnerable population. So the elderly in care homes, healthcare workers, doctors, people working in hospitals, police officers, firefighters, these people that are going to be most vulnerable or most exposed to the virus. It will take much longer for the vaccine to be available to the general population. It's likely that we won't see most people having access to the vaccine until potentially the middle of 2021 or later on in the year. That means that herd immunity is likely not going to happen until late 2021 or early 2022, because that herd immunity means that about 60 to 70% of the population either has to have a vaccine or have had the virus. So it's going to take a long way to get there. And as well, we still don't know what sort of challenges we're going to face in the distribution of the vaccine. We've seen, for example, Pfizer and BioNTech actually having the amount of dosages they plan to deliver this year because they're facing certain constraints in their supply chain. So there's still a lot of questions about what sort of obstacles we may face in the coming year as we try to get the vaccine to the population. So these hopes about herd immunity, it still is a long way off.
All right, Chelsea, thanks very much for giving us a better sense of where things stand, particularly in the EU. Moving on for now to the US, which is battling a massive surge in COVID-19 cases, in an all-time high for the country since the start of the pandemic. The nation recorded more than 210,000 COVID-19 cases in just the last 24 hours.